Hey guys, Dr. Tyler McClimon with McClimon Chiropractic, and today we're going to talk about three of the main reasons that we get neck pain today. And we're going to also talk to you about how what we do to relieve neck pain is different than everybody else and why we get such great results with that. So guys, today, look, neck pain affects about 30% of people on an annual basis, which means it's probably going to affect you at some point in your life. So it's a very common ailment that many people suffer from. And there's three main reasons that I see that we commonly, what causes neck pain today. One of those reasons, guys, is that we don't actually take care of our spine, okay? So think about this. If you didn't brush your teeth for a day, a week, a month, a year, would your dental hygiene be better or worse? Yeah, it would suck, right? So if you don't take care of your teeth, they rot. If you don't take care of your spine, it rots. So look, your spine is what houses your nervous system that runs your life. So if you don't take care of it, it's not going to be as healthy. So one of the main reasons that we have not only neck pain, but a lot of other issues in the body is that we don't take care of the thing that houses our computer system, our nervous system that runs our life. So that's one of the key points here, guys. Is if you've never actually checked your spine, which houses your nervous system that runs your life, it's a good place to start. Because it is what runs your life and it's inside your spine. If you never check that, I would start there. So not checking your spine is definitely one of the reasons why we get into trouble. And the reason that is, guys, is because we base health on one thing. We base health on how we feel, okay? But how we feel is a terrible reflection of what our health is. So, and when we're talking about neck pains here, the second reason is technology. And this is why these two kind of go together, is technology impacts the structure of the spine, and with all of us looking down at computers, at phones, on a daily basis, the average American today looks down on a phone, on a smartphone, over 5 hours a day. The average Gen Z looks on a device over 6.5 hours a day. If you look down at a device half of the hours of a day, it's going to not only give you neck pain, it's going to cause a reversal of the cervical curve, which pretty much takes years of your life away. Not to mention it contributes to osteoarthritis. See, we don't get osteoarthritis in the spine because we're old. We get it because we have old misalignment. So when the spine shifts out of place, it puts not only pressure in your nervous system, but it's bad biomechanics. So if you drive on a crooked tire, it wears out faster. You live with a crooked spine, it wears out faster. So we don't get osteoarthritis or wear and tear because we're old. We get it because we have old misalignment. So the second thing, technology, very damaging to the cervical curve. If you have kids, you have younger ones, make sure half the battle is being conscious of your posture on those devices, on technology. Please try and get away from looking down. It is destroying the cervical curve. When you lose that cervical curve, guys, look, the cervical curve is 7 times stronger with the proper curve in there. And you have when you lose the cervical curve, in other words, it's straight or it's backwards, there's 20 to 30 times more pressure put down on your nervous system. So it's no wonder, carry a bowling ball here and carry it here. When your neck is backwards, it's carrying it out here all the time. And then we wonder why we have neck pain and tension headaches. So structure is very important to function, and technology is causing us to lose that structure. So be really conscious of your posture around technology and devices. So number 2 reason is technology today. And thirdly is alignment, okay? So alignment and biomechanics of the spine are very important. Obviously, technology ruins that alignment, which is why we have neck pain. But the other thing is alignment in the sense of what we call subluxation. So the bones of the spine can shift out of their normal position and put dangerous pressure on the nervous system. That's called subluxation. I'll show you a model here in a little bit. That puts pressure on the nervous system. That affects whatever that nerve controls in the body. So if it's your neck, it could give you neck pain. But guess what? There's 50 other things that can happen in the neck that you don't feel when there's pressure. Because what happens today? We base health on what? How we feel, okay? We base health on how we feel, not because health is how we feel. We base health on how we feel because we've been trained to do that. Listen, in the United States today, heart disease and cancer are the 2 top killers of people. Do we typically feel heart disease and cancer? No. But here's the 2 things killing the most people we don't usually feel, but we still base health on how we feel. It's not congruent. It doesn't make any sense. But the only reason we do it isn't because it's true. We do it because Big Pharma trained us to do it. So I'm training you right now not to do it, because that's what kills your health. That's what leads to disease and dysfunction in the body, because no one ever proactively looked at the system that runs their life. They just wait till it hurts. Again, are you going to just brush your teeth when they hurt, or are you going to brush your teeth to keep them healthy? Same thing with the spine. When we don't take care of it, we don't look at it, it decays, it degenerates, and leads to dysfunction and disease in the body. And that's not where you want to be. You want to be proactive with your health. And so alignment has a lot to do with the function of the nervous system through the condition called subluxation. If it misaligns, it presses on nerves, affects what those nerves control. That's what we have, the spinal nerve chart. Okay, the spinal nerve chart, we'll show you a smaller picture that has all the nerves as they come out of the spine and different effects that occur depending on where there's pressure. So C1 could affect headaches, high blood pressure, dizziness, neck pain, right? C2 could affect your sinuses, your allergies. C6 could cause pain in your neck, even neck pain going down your arm, right? C7 could affect your thyroid gland. So every nerve controls something different. So we find where those subluxations are, make specific adjustments. That restores the communication between brain and body, and allows the nervous system to function properly and the body to function properly. Guys, chiropractic is a lifestyle that helps create healthy human beings by allowing the flow of information that keeps the body healthy and healing, operating without any nerve interference. So to help with neck pain, we focus on the things that actually are the root cause of the neck pain, rather than just trying to mask the symptom with a drug or some kind of therapy or some kind of food, right? So that's the difference, is we focus on the root cause of the problem rather than just masking the symptoms. And so if you guys are suffering with neck pain, you've never looked at your spine, never had it evaluated, never looked at your technology, and never looked at your alignment, it's really something you want to do. Again, alignment's important. We don't get arthritis because we're old. We get osteoarthritis because we have old misalignment. If you haven't checked it, you definitely want to check it. So you guys have neck pain and you come in the office, just kind of give you a little walkthrough as to what you'll experience when you come into the office. We come into the front desk here. This is where you'll see Marcella. Marcella will be back here to greet you. You'll fill out your paperwork unless you have it done ahead of time. And then as you come into the office, we'll bring you back, okay? Office looks like this. We have an open adjustment setting, good for flow purposes, also good for educational purposes. We do focus on correcting the spine. Obviously, after what I just told you, structure is very important. And this is a neck picture. So you can see a neck here. This is after 12 months. You can see better structure. Better structure will give us better function with the nervous system. It will also help prevent that degenerative arthritic process from either happening or from coming about in the first place. This is also why we especially see a lot of kids and families. Chiropractic is not only good for adults to get well, but for kids to stay well. Just like dental hygiene, we promote spinal hygiene. The spine is the structure that houses the nervous system that runs every function of the body. The healthier the spine is, the healthier we are. The sicker the spine is, the sicker we are. Drug jug. A lot of patients come in and take different medications for symptoms, conditions. But as we improve function, chiropractic patients take about 85% less medication. That's right, 85% less medication for people under chiropractic care. They go in here, and that's always a win. Talking about neck pain, we talked about the structure of the spine. We talked about technology. A lot of people today have lost that proper curve in the neck. That's called the arc of life. The neck is 7 times stronger with that curve in there. But with technology, devices, computers today, it's really stressful on that. A lot of people have lost that, where that curve is now going backwards. You do not want that. It's terrible for your health, and it contributes to osteoarthritis and pain. So cervical molding helps to restore that, along with adjustments. Restroom we have in here. As you come back in here, we will do your exam. Exam room in here. I'll have Marcella show you the spinal nerve chart here. Okay, so this is the nerve chart I was talking about. Shows you all the nerves as they come out, and then different effects that occur depending on where there's pressure. Okay, just to give you a little view of the spine here. We're talking about subluxation. So normally we have a curve like this in the neck. When we lose that curve, see how it stretches that spinal cord inside? If that curve goes backwards, like this, it puts a tremendous amount of stress on the spinal cord and on the brainstem. That will give you neck pain. That will definitely affect the functioning nervous system, and it will contribute to osteoarthritis down the road. You do not want that. You want to have that proper curvature in there. And the only way to really evaluate that is through a proper exam and a specific x-ray. But that will tell you the truth as to the health of your spine. So after we do the exam in here, we do some orthopedic tests for your specific symptoms, get a history, we check posture, we check balance, and then we do our exam. From there, we always take x-rays. To see is to know, not to see is to guess. We come back into the x-ray room here. Back here, we'll do your x-rays. And then here, we have digital x-ray in here, guys. So state-of-the-art technology to give us the best pictures of your spine so that we can truly evaluate that and give you the best care specifically to your subluxation pattern and your issues. So x-ray here. From there, day 2, we have you come back. We do a doctor's report of findings. That is in here. So we sit down here one-on-one with the doctor, and we go over what we found in your exam, in your x-rays, and let you know if you have subluxation, if this is a chiropractic case, and go over how long it'll take to, you'll have to come in, how much it'll cost, and how to give you the best result. So do the doctor's report in here, guys. So just to recap, remember, neck pain, very common condition today. Most people will experience that at some point in their life. If you're suffering with neck pain and you tried medications, you tried therapies, you maybe eat better, you know, you tried everything you can, but you haven't checked your spine, it's probably the reason that you're not getting rid of the root cause of the problem. Look at this, guys. This is your spine. Here's your spine. When that spine shifts, okay, like this, puts a tremendous amount of stress on that neck. Is a medication going to fix that? Is a therapy going to fix that? Is eating healthy going to fix that? Is stretching going to fix that? The only thing that's going to fix that is a specific series of specific chiropractic adjustments, corrective chiropractic adjustments, to correct the spine, to restore the structure, which restores the function. When you have this, guess what you have? Tight muscles. That tight muscle, you can massage it, you get therapy, you can take a pill. You don't fix the structure, it's not going away, okay? So if you haven't checked this, definitely a good idea. It will not only help you get rid of your neck pain, it's going to restore function to the rest of your body in many, many ways that you don't feel, okay? So guys, I've been doing this over 20 years. We're experts at it. We take care of the spine because the spine is what takes care of you. So McClimon Chiropractic, you guys know where to find us. Hope this information has helped you out, and we look forward to seeing you soon.